Hey guys, I have another video for you on TMJ today. This one is a little more advanced, so make sure that you really know your anatomy and physiology before you proceed, and proceed with caution, and proceed with care, and proceed with communication. That being said, I want to communicate with you guys. I've been getting a lot of great comments on my videos, and I go to respond sometimes, and I don't know what's happening, but the comment doesn't load. It's telling me it won't load, and I'm not sure what the problem is, but I just wanted to kind of flat out say, I appreciate you guys, I love your comments, I love your feedback, please keep it coming. Okay, back to the hands-on work. So I'm starting off with a lot of work in the face, and I can't express enough that I feel like this is necessary. Working through the zygomatic arch, working into the bones of the face and the skull. I think it's hugely important for the one moving joint that we have in our head. And then there's all those joints that hold our head up. So all those little intervertebral joints of the cervical spine, I want to make sure that they're moving, and I want to make sure that the front of them really opens up. I'm taking my hands and I'm using them to push the front of the neck forward and then pull the occipital ridge back, creating a nice kind of a wave movement in the neck. The next thing I want to do is work right into the suboccipitals, and while I'm doing that, I'm going to have my client bite down with her teeth. And this activates the TMJ, activates the masseter, and activates all the muscles that kind of are involved with engaging the jaw. And it doesn't just stop with those two muscles that we typically work on. It goes all the way around the back of the skull and into the neck and up through the forehead and continues on from there. As I'm doing this, I want to bring my client's awareness to what she's feeling. So it's really important to talk to your client as you're doing this work and ask them if they're feeling the relationship between the muscles that are contracting underneath your fingers in the back of their neck to the muscles that are used to activate the jaw and to move the jaw. Once my client and I have really established that relationship and really sunken into what the entirety of this joint feels like, I want to do some work specifically into the joint itself. So I'm working right in front of this little ear flap, which I think is called the tragus, and I'm sinking in as my client opens up her jaw. So as she is depressing her mandible, I can feel that space open up, and I want to sink in and start to access some of the more intrinsic, deeper muscles of this space. Turning my client's head to the side, I'm using my left hand to support the head and the neck and manipulate how it moves as I work into this joint. So as I sink in with my finger in that same spot that I was working just previously, I'm now moving her head and neck with my left hand very subtly and in a motion that is going to help to reset the jaw. You can't see it here, and I wish I had done a better recording job of this, but I have my left thumb supporting the lateral aspect of her left mandible. So as I sink in on the right side and her jaw wants to shift, I'm supporting it, and I'm really focusing on just the work that I'm doing as opposed to moving the whole jaw from side to side. So if you want to sound really smart here to your client, you can start throwing around the names of the muscles that are deeper into the jaw called the pterygoids. And there's a medial one and there's a lateral one, and if you've ever seen anybody do any TMJ work where they're coming in with a glove and they're working on the inside of the mouth, they're working on the medial pterygoid, and we're affecting the lateral pterygoid here, and ultimately we're affecting both of them, because once the jaw opens up, all those attachment points come right into the joint itself. You're affecting how these muscles operate just from the work that you're doing. As I start to move away from the pterygoids and the jaw itself, I want to make sure that I apply some friction into the masseter. The masseter is the strongest muscle in the body and definitely holds a lot of tension. Any kind of friction into the jaw and into the face can feel pretty aggressive to your client, so make sure that they are not experiencing any dizziness or headaches that sometimes gets associated with TMJ, and that they're ready for this work. So if this is their first time coming to you, please stay away from anything that feels too deep or too aggressive. But if this is something that you are working through and you're working with your client over a series of weeks, start to dig in, start to create some friction, and start to break apart those adhesions that are locking the jaw and creating that click. You'll notice here that I'm working from the ear to the chin, and I'm working my way out, ensuring that all of this connective tissue wrapping around the jaw and wrapping around the bones really is starting to loosen up. The next thing I want to do is address the SCM, and I've got a whole nother video on that, so I'm going to include the link right here. And if you want to check out how to work the SCM, please click on that link. But the reason why I want to do this is because the next thing I want to do is address the hyoids, specifically the infrahyoids, and make sure that we address the entirety of the neck. Like I've been saying, I want to get to the very deep muscles and the very core muscles that are involved in jaw movement. So the infrahyoids are these stringy little muscles that come down from the hyoid bone, which is the bone that anchors your tongue, down the anterior neck and attach either into the sternoclavicular joint or onto the superior angle of the scapula. I'm sinking down very gently with my finger pads and using a lot of caution and a lot of communication. As I find the infrahyoids, I'm sinking down underneath the hyoid bone, and just like you just saw, I have my client open her mouth, or I can ask her to hold her tongue down into the bottom of her throat, and you can feel those muscles contract really slightly. Once you're positive you've isolated these muscles, have your client scooch up towards you so that her head comes off the edge of the table, and you're going to support her head and make sure that she's really trusting you. You've got to have a great relationship with your client here, and you have got to be confident in your work. Again, I'm locating the SCM and the trachea, sinking just in between those two, and very gently and very slowly asking my client to open her mouth or hold her tongue down. And as she's doing that, I'm sliding down away from her jaw and creating a myofascial stretch. The specific names of the muscles are the omohyoid and the sternohyoid, and as you can see here, they're tiny and they're underneath a lot of structures, and they are next to a lot of very important structures. So as body workers, we don't dig here, we don't provide trigger point therapy, we don't create a massive adjustment. We are very subtly trying to open up the connective tissue that surrounds this and allow the jaw, allow the hyoid bone, and allow the tongue to move freely inside of the mouth so that the jaw can move freely in turn. Be sure that you really know your structures of the neck before you start diving into the anterior neck. It is unbelievably protected, it is unbelievably important, and we need to be unbelievably safe. That being said, as we create a foundation of trust with our clients, I can hold my client's head and I can sink down very subtly and very gently into these muscles and allow this connective tissue to slide down as her head is falling backwards, creating an opening in the front of the neck. Using a broader point of contact here, I just want to settle everything into place. So I'm going to hook in just underneath the clavicle and use my hand that's holding her head to guide her head back and away from where I'm pressing, creating a nice open stretch. I'm a huge proponent of altering the work that I do within any session, and so I like to keep the speeds varying and keep the specific/broad work varying. I've done a lot of specific work into the jaw and into the anterior neck, and now I want to, with my client's head back up on the table, use my palms to really sink into all the work that I've done. So using both hands on either side of the jaw, I'm going to slide down towards the chin, and then I'm going to use my palms to really press either side of the jaw and squeeze all of those muscles down, kind of releasing the jaw down and using a little bit of a vibration within the jaw and creating more movement in that TMJ. I can also use both my palms to draw broad circles, starting at the zygomatic arch, going down towards the chin, and this is the closest thing I'm getting to petrissage. I'm really kind of creating a deep circular friction, and I'm kneading through all of these muscles that I just did specific work on and I want to broaden out. For my last trick, I'm going to work on the ears. In both of my TMJ videos, I have definitely talked a lot about the interrelationship between the ears and the nose and the throat, and the jaw is kind of at the center of all of this. So ignoring the ears here would be a little bit of ear discrimination. To me, this is not only the icing on the cake, but this is also an honor to all the Eastern theory that we know. On a scientific level, I am pulling out all of that connective tissue that I've worked so diligently to release, kind of really extending that fabric all the way through to the ears because there's no disconnect. And on an Eastern level, I'm addressing all of those reflexology points that are found in the ear that are representative of everything else that could be going on and creates a connectedness from not only this specific issue, but throughout the body as a whole. These last points behind the ear are actually addressing the triple Burnham meridian. Responsible for the circulation of protective and nourishing energy, it definitely can't hurt to address this meridian in your TMJ work. Happy holidays to you guys. Thanks for watching. If you haven't already, please subscribe, click that thumbs up if you like this video, and I hope 2017 brings you lots of health, lots of wealth, and lots of happiness, and of course lots of body work.